As the air in the country remains dangerously toxic, tonight comes an extraordinary alarm. 80. I don't mean 8, I don't mean 18, I mean 8080. Padma and Padma Bhushan awardee doctors, some of India's most respected medical voices, have issued an urgent national advisory saying India's air pollution crisis has now crossed into a public health emergency. These are frontline clinicians. They are warning that the toxic air choking Delhi, NCR, Mumbai and 60% of the country is now affecting every age group. But children, pregnant women, seniors and heart-lung patients are getting hit the hardest. And the risks that outline are dangerous. Worsening cough, eye irritation, asthma attacks, rising chances of hair attacks, of heart attacks, strokes, long-term, even irreversible lung damage in children. They also warn that polluted air is making diabetes and hypertension harder to control. Now, in this rare, clear-cut advisory, the Padma doctors have laid out exactly what families must do now. And two of those, the finest Padma Bhushan doctors join us here on the program today, and we'll try and understand some of those details from them. With me today is Dr. Amrish Mittal, Group Chairman, Endocrinology and Diabetes at Max Healthcare Delhi. Also with me is Dr. Ashok Seth, Chairman at Fortis Escorts Heart Institute and Fortis Healthcare Medical Council. Dr. Mittal, first to you. We've done endless episodes this month, this year, over the years, talking constantly about air pollution. But what you are telling us and what 80 doctors like you, the finest we have in the country, are telling us is that the situation is only getting worse. Is that fair to conclude?
It's certainly not getting better, Sonal. If anything, it's getting worse. And despite so many alarms raised over the last 10, 15 years, we haven't really seen any discernible improvement in air quality. And the studies that we are doing or others are doing and we are publishing and others are publishing are largely related to the adverse effects of pollution, which makes you feel even worse because you really realize, you begin to realize that it's not just the heart and the lungs. So many parts of our body are affected by this air pollution, and we seem to be going nowhere actually. We are just going round and round and round, and that's the tragedy, you know.
Yeah, we're doing round and round, just like there's like the water sprinkling systems that's going on and on, just like how that data is being manipulated. Also, the data on farm fires being manipulated. We look at that. Dr. Ashok Seth, does it frustrate you as much as it frustrates us here reporting that over the years nothing seems to have changed, it's only gotten worse? And does it frustrate you with a similar degree when you see Parliament not taking an issue like this on priority? Parliament is not on a break. Parliament is meeting in the same toxic air. They are breathing the same toxic air. Or as some people told me on my Twitter feed the other day, that maybe there are air purifiers inside and that's why they don't care.
Recording in progress. Recording in progress.
It's the word is not frustrating. The word is annoying, anger. This is really a situation where, we talk about seasonal pollution. We talk about it only during this month. Believe you me, what we emphasize to all policymakers and to the nation is the fact that throughout the year, we live in a gas chamber.
Yeah.
It's not a seasonal issue. This is what's spoiling our health. This is practically what's ruining we talk about strokes increasing, we talk about diabetes going out of control, we talk about bad lungs, people dying of heart attacks, people dying of lung problems. Can you believe a third of our population is dying because of the pollution itself? And then we talk about it in such light manner that acha is October, November mein to kharab ho jata hai. But actually, it's a right. It is a human right to breathe fresh air and have clean water, correct? Where did we ever hear that this was not a human right? And yet, the saddest part, the anger, is related to we cannot be provided with fresh, clean air. We would love for all our children to be coming back to India and living here, except each one of our children, some of whose children are out, say, कि हम किस पे आए? We love India. I think everything in India is great. But हमारे बच्चे कैसे उसमें पैदा होंगे जिसमें कि वो सांस भी नहीं ले सकेंगे, and they may not even grow up, उनके genes ही खराब हो जाएंगे. You know that this air actually creates not just the problems of khasi, zardi, zukam, etc. that we're talking about, apart from strokes, etc. It causes genetic changes. It actually causes cancer. It causes brain fogs. It actually causes clear dementia. So we just don't talk about कि खांसी सर्दी जुकाम हो गया और उसको उससे बचना है. It's
It's
a
just,
killer. It's actually a
yeah.
killer. And we just don't seem to be seeing this killer. And then we talk about all sorts of health statistics saying हमारा हिंदुस्तान, तो statistics देखिए कितने अच्छे statistics हैं. I'm amazed. Sometimes it's so actually the reason we wrote all this was not the anger, but was the realization. At some stage, realization has to come that you could list down 200 diseases it causes, the pollution is causing, and also the massive increase in deaths that have resulted in the last 10 to 15 years, strokes, diabetes, hypertension, and heart attacks, as well as
1 second, you're
dementia
saying
in this country.
200 diseases that have a direct link
They-
with air pollution.
Absolutely.
And 1/3
Absolutely.
of the deaths are due to air pollution. That's what you're saying.
Absolutely, absolutely. 1/3 of all the respiratory deaths. We're talking about 1.7 million air pollution deaths. Well, that could be a lot more, but 1/3 of all deaths from chest problems is happening because of direct effect of the pollution on those people. There's an increase, can you believe, of 200% in heart attacks and deaths from heart attack when it goes to this level of hazardous. But what about what's happened over 15 years of the increase in heart attacks in youth that we call about saying lifestyle? And can you believe the lifestyle got created by this country, jahan pe ki pollution has created the worst lifestyle, and not necessarily the youth. The youth is suffering from the pollution far more than the lifestyle of saying galat kha liya ya exercise nahi ki. Today, when my patients ask me ki exercise kahan kare, kya kare, kaise kare, I have no words to say. I can't tell them to go out in that weather, in that pollution, and say, usme aap exercise kijiye. Perhaps he may not even survive the length of the duration of survival that he has in his. And this is like smoking 40 cigarettes a day.
Dr. Mittal, the frustration, I don't know. I don't know how people sleep, people who have the power to do something and not doing anything sleep with themselves. I don't know how they get sleep at night knowing that this is a slow poison that has been infused upon us. And this is not Delhi, like Dr. Seth was saying. This is not winter. This is 60% of the country. Just imagine the impact it will have and the load of patients that the medical infrastructure will be facing in the coming generations as well. But, you know, like I said, we could go on about it, but I want to talk solutions now, because if the government is not doing anything, what is it that we can do? Dr. Mittal, you guys have put together an excellent list. Could you take us through that, apart from the obvious ones that we know, which is wear an N95 or N99 mask, have air purification, HEPA filter 13 or above, have your purification done in the cars as well, because that's where maximum vehicular pollution is coming in. People are stuck for 2 hours in a traffic and they don't even realize what that staying in the car is doing to them. Ensure that kids are not playing out, even if the sun is glaring and you think, aaj to hawa saaf lag rahi hai, par hai nahi, or AQI is still saying 300.
So I think, Sonal, there are several aspects to this. You've listed out what people as individuals can do, but there's only this much they can do. I mean, how can you live in an environment totally controlled by air purifiers and the HEPA filters? I mean, that's not possible. And for large segments of the population, even talking about that seems a little, ironic. I mean, it's really not correct to talk about those
It's
solutions.
a privilege.
Yes, it is a privilege. We can talk about it, but most of our people cannot. So I think it's really important that there are, and everyone realizes, anyone with any sense realizes, there is no quick fix to this. We don't think anyone has a magic wand that it'll just sort of wish away all the stuff we're talking about. But we need to have a structured plan. We need to have a structured plan that is evident to the public. We need to know what is happening now, this year, what is the change, next year, what will be the change, the year after that, what will be the change, so that over a period of a few years, we can implement
We
major
need a
changes.
plan.
Like Beijing did.
Yes,
Like Beijing
yes.
just was the worst city in the world and became completely clean. Of course, people say in China it's easier to implement things, but the fact is that we do need to go in that direction. We can't keep, sort of passing it on to the next person all the time. So this has really become a big problem. And as Dr. Seth very rightly said, the issue of it being there around the year and an acceptance of levels which are clearly 2 or 3 fold higher than WHO recommendation. And in these times, there are
Dr.
10,
Mittal,
20.
can I ask you a question? And I've been trying to wrap this around my head as well. When doctors are saying, please do something, we are reporting and saying, please do something, doctors are getting desperate enough to say, leave the city if you have to. Why do you think the politicians have not woken up? They're not even recognizing it as a problem. They're allowing green crackers and the rest of it to happen. I'm sure you meet so many politicians who come to you. They are your patients. When you talk to them, what's the reply? What do they tell you?
No, I don't think it's that they don't realize. I mean, I really do think that they very well realize they're all living in this. It's not happening in some remote part of the country. I think our politicians or bureaucrats or whoever is in charge, they definitely realize the problems. I think there's need for a concerted, a coordinated response, which somewhere is not really happening, and a long-term response. The issue is not a short-term, spraying of this or
Yes.
that. It's actually a long-term response, a plan that we need to see to really help,
I
because
have last 1 minute and I have Dr. Seth's finger going up. So very
Yeah.
quickly, sir.
So I think the realization is there, and it's increasingly, and in fact, these are the sort of realizations, the sort of programs that you've been doing, the sort of letter that we've written. But there's a realization. I tell you, in the past, this actually has been a blame game politics.
Yeah.
It's actually now coming to a realization where it does need to become a national agenda of every policymaker, of every politician, and for that matter, for every individual in this country, that kis tarah hum pollution ko kam kare. It should be the first thing which everybody should wake up with, and
Yes.
actually should be the last thing we say,
Yes.
ab aaj kya ho sakta hai? Now, the policymakers can do better than that. We, in our own, can do daily something which can help. But the policymakers need to make an agenda as a national agenda saying, ye to hamari emergency situation hai.
But
Just
why
like
aren't
COVID,
they? I'm
just like COVID came in
really
and
trying to
create a
understand
policy
why they
over the
don't
next-
get something as simple as this.
I
You
think,
have
yeah,
the
so
Padma
does-
awardees, you have the best doctors in the country, doctors who treat these politicians as well, telling them, please wake up. And still, well, we're debating 10 hours of Vande Mataram, we're debating 10 hours of some other bill, but there is 0 hour taken out for air pollution inside the parliament, and that for me is very, very troubling. And we really hope that the letters that all of you have written, at least that rings a bell, if nothing else. Thank you so much for doing what you guys are doing, and thank you so much for keeping the fight for demanding clean air going on.